All right, let's dive right in. We're going to tackle a really classic, high-stakes scenario, new-onset mania. By the end of this, you're going to have a powerful clinical framework that you can take with you and use on your very next call shift. So let's do it.
So, imagine this. You're on call, and a 45-year-old patient comes in with their first manic episode. It is so tempting to just slap a bipolar disorder label on it, right? But hold on. The truth is, we have to be detectives first. We're going to explore why your first, most important thought should always be, okay, what medical condition could be causing this?
So, here's our game plan for today. We'll start with the organic first mindset. Then, we'll dig into the clues in the history. Learn how to spot those critical red flags, walk through a smart, tiered investigation strategy, and then we'll pull it all together with a Vindicate framework.
Okay, Section 1, the organic first mindset. Now, if you take only one thing away from this explainer, let it be this. When you see new-onset mania, especially in someone over 40, you cannot treat it as a diagnosis. You have to treat it as a symptom, just like a fever or a headache. Your number one job is to hunt for an underlying medical cause before you even think about a primary psychiatric diagnosis.
That brings us to Section 2, clues in the history. And this is without a doubt your single most powerful diagnostic tool. Seriously. The clues that separate an organic cause from a primary psychiatric one, they're almost always hiding somewhere in the patient's story. Let's look at what you need to find. The very first clue is always the timeline. Just look at how this temporal profile immediately narrows down your differential diagnosis. I mean, if the onset was hyperacute, we're talking hours to maybe a couple of days, you have got to be thinking toxic or metabolic causes, intoxication, a stroke, something like that. But if it developed over days to weeks, that subacute category, your brain should immediately pivot towards inflammatory or infectious causes, like autoimmune encephalitis. This timeline is your first and most powerful filter.
Okay. Next up, you have to listen for atypical features. You know, classic bipolar mania, it often has that euphoric, expansive quality. But what if your patient's presentation is just dominated by this intense, gnawing irritability? Or if they claim they haven't slept in 3 days but show zero signs of being tired? That's when your organic antenna should be going way up. These just aren't the typical patterns we see in primary mood disorders.
And of course, a thorough review of systems and getting collateral information is absolutely non-negotiable. You have to ask, any fevers, weight loss, what about new headaches or seizures? And you must review their medication list. I mean, did they just start a course of steroids? Are they using stimulants? This information is pure gold, and honestly, it often gives you the diagnosis right there.
All right, let's move on to what is probably the most high-yield part of this entire evaluation, both for your board exams and for your clinical practice: spotting the red flags. These are the signs and symptoms that tell you, hey, you need to escalate this medical investigation now.
And I really want you to let this sink in. The presence of even one of the red flags we're about to show you should completely change your entire approach. It is your signal to stop, dig deeper, and escalate that medical workup immediately.
So here they are. These are the critical red flags. Is this their first episode, and are they over the age of 40? That's a huge one. Are there any new neurological signs popping up, like a tremor or a seizure, or any autonomic instability? You know, look at the monitor. Is their heart rate and blood pressure all over the place? These are not features of classic bipolar disorder. These are screaming that a medical illness is masquerading as a psychiatric one.
Okay, so you've taken a great history and you've identified one or more red flags. Now what? Well, you don't just order every test in the book. That's not good medicine. You use a logical, tiered approach to your workup. This tiered strategy is what keeps your workup both thorough and efficient. Tier 1 is your essential screening that you do for pretty much every patient. Tier 2 is what you add only when those red flags are present. That's what lets you dig deeper without just ordering a bunch of unnecessary tests.
So let's break that down. Think of your Tier 1 labs as the essential safety net. You're going to get a CMP, CBC, thyroid studies, a tox screen on basically every patient with new-onset mania. But if your patient has red flags, like a new headache or some focal weakness, that's when you move to Tier 2. That's when you start considering things like a brain MRI or maybe even a lumbar puncture. So, you've done your history, you've spotted the red flags, you've ordered your initial tests. To pull it all together, you really need a way to organize the massive number of potential causes. And that is where our final tool comes in. This, my friends, is the Vindicate mnemonic. It's an absolute lifesaver for structuring your differential diagnosis. I'm telling you, Committing this to memory is one of the single highest yield things you can do. It makes sure you don't miss a whole category of disease when you're under pressure.
Let's see how this works in real time. If you're thinking I for iatrogenic, you're looking for that close temporal link to a new medication, like steroids. If you're considering E for endocrine, you're hunting for those signs like tachycardia and weight loss that would point you towards hyperthyroidism. You see, the framework connects your red flags directly to potential diagnoses. It's beautiful.
So let's just quickly recap the crucial points. 1. Always think organic first. 2. Use the patient's history and the timeline as your main guide. 3. Know your red flags cold. 4. Use that tiered investigation strategy. And 5. Organize all your thoughts with Vindicate. If you can master these 5 steps, you will be practicing at a very, very high level.
By applying this systematic, organic-first approach, you're not just treating a symptom, you are potentially saving a patient from a missed and maybe dangerous medical diagnosis. So the real question is, on your next shift, which organic mimic of mania will you be the one to catch? Thanks for watching.